Maximus is innervated and supplied by the inferior gluteal nerve, artery, and vein, which comes out below piriformis. Piriformis is the defining muscle of the region here. Above piriformis, we've got gluteus medius. Gluteus medius actually comes all the way around to the front, so we can actually see gluteus medius underneath the tensor fasciolata here. Underneath gluteus medius will be gluteus minimus, and traveling between gluteus medius and gluteus minimus will be the superior gluteal nerve, artery, and vein. Superior gluteal artery, nerve, artery, and vein supply gluteus medius, gluteus minimus, and come all the way around to innervate the tensor fasciolata. Tensor fasciolata goes from the ASIS down to the iliotibial band. Coming out below, so that's the only thing above piriformis is the superior gluteal nerve, artery, vein. Coming out below piriformis, we'll have the inferior gluteal nerve, artery, and vein going into gluteus maximus. Also coming through the angle of gluteus maximus, we'll have a nerve called the posterior femoral cutaneous nerve that innervates the skin on the back of the thigh. Don't have it on this model, make sure you know it in a book. Also coming out below piriformis will be the pudendal nerve and the internal pudendal artery. We have the artery here that goes between the sacrotuberous ligament and the sacrospinous ligament. The sacrospinous ligament is deep to the sacrotuberous ligament. Ischial spine to sacrum, ischial tuberosity to sacrum. So the internal pudendal artery and the pudendal nerve go underneath the sacrotuberous and sacrospinous ligaments. We also have the sciatic nerve coming out below piriformis, and the sciatic nerve is actually subdivided into the tibial branch of the sciatic nerve, which is more medial, and the common peroneal branch of the sciatic nerve, which is more lateral. Other muscles we have here underneath piriformis is superior gemellus. Underneath superior gemellus is the tendon of obturator internus, then inferior gemellus, then quadratus femoris. If you follow the tendon of obturator internus inside, this is actually the obturator internus muscle in here covering the inside of the obturator foramen, then coming around the sciatic notch to attach to the greater trochanter here. So these are going to externally rotate the hip. Superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Right below quadratus femoris, we're going to see an artery here. That's the medial circumflex femoral artery, number 50 here. We move down to the posterior aspect of the thigh. Posterior thigh is going to have the hamstrings. Hamstrings come from the ischial tuberosity and come down. Semitendinosus and semimembranosus go medially. Long head of the biceps goes laterally. They're innervated by the tibial branch of the sciatic and supplied by perforating branches of the deep femoral artery. Underneath the hamstrings, we have this muscle here, which is called the short head of the biceps femoris. It comes from the linea aspera and goes laterally to the tibia and the fibula. The short head of the biceps femoris is innervated by the common peroneal or common fibular nerve. So we have the sciatic nerve branching into the tibial nerve and the common peroneal nerve. Up here above the knee, both of these nerves are going to give off a sural nerve. Tibial nerve is going to give off a medial sural nerve, which will head down the back of the calf with the lesser or small saphenous vein. And the lateral sural nerve will come off the common peroneal. When they get here on the calf, they're going to join together, go around the lateral malleolus and the lateral ankle to be the sural nerve just around the ankle here. So we've got medial and lateral sural nerve with a small or lesser saphenous vein coming up the back of the calf. You're not seeing that on this. So coming across the back of the leg here, we've got the iliotibial band. We've got vastus lateralis, which is one of the quadriceps, short head of the biceps femoris, long head of the biceps femoris, semitendinosus on top of semimembranosus, adductor magnus, perforating branches of the deep femoral artery. Underneath adductor magnus, now we have gracilis and sartorius that we can see from the backside. We come down here as we continue down the back. We've got the popliteal artery. It was the femoral artery in the front, but now it's the popliteal. Popliteal artery comes through, gives off a superior lateral geniculate, a superior medial geniculate, inferior lateral, and inferior medial geniculate. These are wrapping all the way around the knee, so they may be tagged here coming off the popliteal, or they may be tagged here coming around the knee in the front. So we've got the tibial nerve. As soon as the popliteal artery passes the attachment of soleus, which we're going to do as the head of the fibula right here, the popliteal artery changes names to the posterior tibial artery. The posterior tibial artery gives off the anterior tibial artery, which heads down the front of the interosseous membrane with the deep peroneal nerve to supply and innervate the anterior compartment of the leg. Once the anterior tibial artery crosses the ankle, it's called the dorsal pedal artery. The deep peroneal nerve stays the deep peroneal nerve, innervates the muscles of the anterior compartment of the leg, and then comes out here to innervate the skin between the first and second toes. So this is the dorsal pedal artery and the deep peroneal nerve. This is the anterior tibial artery and the deep peroneal nerve. Back on the back of the leg, the next branch off of the posterior tibial artery is the fibular artery. The fibular artery is going to the lateral compartment of the leg, where it is going to supply the peroneus longus and brevis muscles. The superficial peroneal nerve innervates peroneus longus and brevis muscles and then comes down to innervate the skin on the top of the foot. So these branches are both superficial peroneal innervating the skin on the top of the foot. Muscles on the back of the leg. We call this the posterior compartment of the leg. They're innervated by the tibial nerve, supplied by the posterior tibial artery. We go 3-1-3. 3 muscles that make up the calf. They are gastrocnemius, lateral head, medial head. This is the plantaris muscle with its small thin tendon here. And this is soleus. Soleus does not cross the knee joint. Then we've got one muscle that stays up here in the popliteal fossa. This is called popliteus. 3 muscles that go around the medial malleolus with the nerve and artery. This is flexor hallucis longus, tibialis posterior, flexor digitorum longus. Right before they cross over the medial malleolus now, flexor digitorum longus and tibialis posterior change names. Now we go tibialis posterior, flexor digitorum longus, flexor hallucis longus. And we're going to meet up with them on the bottom of the foot. The lateral compartment of the leg, we've got peroneus longus and brevis. Peroneus brevis attaches to the 5th metatarsal. Peroneus longus actually goes underneath the foot. Lateral compartment is innervated by the superficial peroneal nerve and supplied by the fibular artery. Anterior compartment of the leg, we've got tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Tertius comes to the 5th metatarsal. If your name is peroneus, you evert the foot. If your name is tibialis, you invert the foot. Anterior compartment is innervated by the deep peroneal nerve and supplied by the anterior tibial artery. Also on the top of the foot here, we've got extensor hallucis brevis, joining extensor hallucis longus. We've got extensor digitorum brevis, joining extensor digitorum longus. And then way down here, we have 4 dorsal interossei. As we work our way back up to the thigh here, anterior thigh, we've already met tensor fascia lata. We've got sartorius here, going from the ASIS to the pes anserine, where it's joined by gracilis and semitendinosus. We've got the iliopsoas muscle here, which attaches to the lesser trochanter of the femur and flexes the hip. We've got rectus femoris, vastus lateralis, vastus medialis, and vastus intermedialis, which make up the quadriceps. These are going to be innervated by branches of the femoral nerve that are called nerve 2, whatever muscle they're going into. This branch of the femoral nerve that comes down with the femoral artery and vein is called the saphenous nerve. Saphenous nerve travels with the femoral artery and vein until the femoral artery and vein dive through the adductor canal to become the popliteal, and the saphenous nerve is going to continue down here to innervate the skin on the shin. Here, the saphenous nerve will actually be accompanied by the greater saphenous vein. So veins, we've got dorsal venous arch, lesser saphenous heading up the back of the calf, greater saphenous heading up the medial side of the leg and calf. We come into the medial compartment after the femoral. This is the femoral artery and vein here, giving off the deep femoral artery. Deep femoral artery gives off lateral circumflex femoral, which has a descending and ascending branch. Medial circumflex is also going to come off of here. This is pectineus. Up underneath pectineus will be obturator externus. This is adductor longus. Then we'll have the anterior obturator nerve, artery, and vein. Then we'll have adductor brevis. Then the posterior obturator nerve, artery, vein. Then adductor magnus.